I am excited every morning to come to work. I get the opportunity to live a purpose-driven life right now. Every day I pray, what could I do today to make a difference in the health of Americans?
Today on 13th and Park, we're joined by Dr. Stephanie Haridopolos, the Chief of Staff to the Office of Surgeon General of the United States. She's a physician who never stopped thinking like one, with an exam room thoroughness and a patient-first compassion. So we sat down and talked about medicine, public health, and what it's really going to take to make the nation healthy. From Ballard Studios in the nation's capital, it's 13th and Park.
I never dreamed going into the White House you'd risk your freedom.
We in Congress will act together when we have to act.
They deserve better, and we owe them some results.
I believe this country's best days continue to remain ahead.
I had no idea the monster we unleashed.
I play every night, and people love it. They're going berserk.
Well, I don't have any Emmy Awards behind me yet, but,
I'm sure they're coming.
I'm so glad to be here on 13th and Park.
So, Doctor, it's so nice to be with you today. We've known each other for years, right?
Thank you so much for having me on your show. This is absolutely amazing opportunity to educate the public of what I'm doing now.
There's something about being a doctor that breeds not just credibility, but for a lot of people, comfort. So tell me, what was it that got you into the practice of medicine? Was there one moment where you just kind of looked up and said, this is why I'm here?
Well, I got to tell you a story. I don't know if you know, but I was born with a hole in my heart. So I had a congenital heart defect called the atrial septal defect. And I was sick growing up, and I was in New York. I was so lucky to have the best doctors at Columbia Presbyterian Hospital.
One of the best.
One of the best, taking care of me. Actually, where Dr. Oz did his cardiothoracic surgeries. So when I was 4 in 1976,
right,
I actually had the open heart surgery. So in December, it will be the 50th anniversary of my surgery.
Wow.
Can you imagine that I am alive doing well today because of them at that time? And so since I was 4, I said, I want to be a doctor. And so I set my North Star at a young age, and I never swayed from that path. So starting life as a patient, I think that really helps with a physician having that empathy and bedside manner.
You might have gotten a call from God early in your life, but you got a call in more recent years from the Trump administration saying, we need you. So let's start talking about the Office of Surgeon General, Chief of Staff. What does the office do? Just kind of give me a basic primer, what they're responsible for. As you hear about it normally in terms of healthcare advisories and moments of real crisis. That's when you really hear the word Surgeon General. I'm sure you have a portfolio of responsibilities. So kind of walk us through that.
Well, let me start with just the honor of a lifetime, having the Trump administration ask me to serve in this role. It's a dream come true and the capstone of my career. I saw patients in Florida for 22 years as a family medicine physician and always thought upstream in preventative care. How do you stay healthy? Yes, I know how to diagnose disease, but how do you prevent it?
Yeah.
So I always wanted to empower patients with knowledge to live a healthy lifestyle. And that was one of my tenets as a physician. And I had a front row seat to humanity for so long. So coming with some public policy in health on a statewide level, whether it be with chair of Florida Healthy Kids Corporation, serving on the Florida Board of Medicine, working on the pill mill crisis with Attorney General Pam Bondi, and serving on a drug state task force. I had some public health experience, and then I had the real world experience on the front lines. So to come on the federal level in the Department of Health and Human Services in such a branded office, it has been in existence since the 1870s. So as chief of staff, we don't have a principal in place. So I get the honor of serving in the capacity temporarily until we get our nominee through, but supporting the priorities of this administration as it pertains to health, and also supporting the secretary in his priorities. So the Make America Healthy Again movement, we have our marching orders, if you will, through the strategic plan that was published in August. So the Office of the Surgeon General oversees the operations of about 5,400 commissioned corps officers. They have been in existence for 227 years, and they're a multidisciplinary group in 11 categories. There are healthcare heroes. They do temporary duty assignments when there's natural disasters. They get deployed when there's the fires in Hawaii. They go to Africa during Ebola crisis in 2014. So it's a true honor for me to work alongside these healthcare heroes.
So these are really the unsung heroes that work with other heroes. Because when you think about first responders in natural crises in particular, and you're coming from Florida as we do, right? We're no strangers to this with hurricanes and other things. I never really thought about the Office of Surgeon General and everyone in that group that are, boots on the ground as well, because there's an immediate need for them as soon as the danger is, at least the initial crisis or danger has passed.
They have been deemed as the invisible corps. I'd love to make them the visible corps. But the Surgeon General will also act as the nation's doctor. Okay. So the way that medicine communicates to the general public on the best scientific data and knowledge out there, and communicate it in a way where the general public can digest it and understand it.
Right.
Right. And then it's the how, and then you describe the what. How do you then live healthier? How do you then prevent disease? How do you avoid risk? And so that is the main issues that the Office of the Surgeon General do. But what I could say is there's many different outlets. You could do Surgeon General report, which is commissioned, that takes multiple years, and it's a robust report that you collaborate with, usually operating divisions with the HHS, or you can do an advisory, not so much an imminent threat, but something that spans a long period of time. Those are shorter, and then a call to action.
So how do you determine what rises to the level of a threat to the point where you need to communicate this to the public?
Well, every day is different. So it really is what is happening today. I think one of the most imminent threats out there right now, as we talk about addiction and overdose, there's a new synthetic chemical that now is being sold at gas stations. And the long word is hydroxymetragenine, but 7-OH. This is a synthetic version of natural kratom. It's not natural kratom. It's actually honed down to a chemical substance that is 14 times more potent than morphine and attaches to the opioid receptors in your brain.
And you can get that at a gas station.
Yes.
How can that be?
Exactly. Wow. It's the perfect storm for this disaster, with maybe not having the regulation and maybe advertising that happens saying it's a natural product. And it's an agnotology of the issues similar to what we had with the opioid crisis.
Is this one of those things that keeps you up at night?
Yes. The audacity and arrogance for it to be sold to the demographics at these gas stations and vape shops, to me, I feel is imminent health threat that deserves more attention. And I applaud Dr. McCary for his press release on this and also bringing the attention to it. Currently, though, we are hoping that DEA rescheduled it to Schedule 1, which will then give the law enforcement the tools they need to further regulate and confiscate.
I remember all the time I was around Pam Bondi, and all the stories she would tell us about babies who were born addicted, right? And how wrenching that is to see that, not only to understand it's happening, but to actually see that happening. Does that kind of change your kind of motivation for going at it with everything you've got?
I don't know if you know or not, but she started a drug task force after the anti-pill mill bill, and I was appointed to that.
I remember.
And so we created this slogan, "Your baby's life shouldn't start with detox."
Yeah.
And it did change the dynamic. People realize, wait a minute, oh, even though it's a prescription, it could affect my baby's life. And so taking that now to a federal level, I can't believe I get the opportunity to live a purpose-driven life right now. Every day I pray, what could I do today to make a difference in the health of Americans?
Yeah, but going back to what you said earlier, talk about the idea of MAHA, which is all about reprioritizing prevention before treatment, sometimes at the end of the line. Mm-hmm. That must have been like music to your ears.
We need to start from the basics, what we're eating, how we're exercising, how we're sleeping. Let's start a little upstream and think about it for preventing disease. When you have, family medicine physicians and primary care doctors explaining that, it makes sense to people. It's just tell me what you're eating. Let's write it down. And then have you come back in a couple months and recheck your blood work. Let's change your life so you feel better.
Right.
And then you come back and you check the labs and lo and behold, wow, the triglycerides are plummeted. Their total cholesterol has come down, their sugar's down, their hemoglobin A1C is better, and they feel better and have energy.
Why is that such a difficult thing for America to have grasped, much less go after with reckless abandon as we're now seeing under this administration? What took us so long?
What took us so long? That I don't know. But I'm certainly glad that now it's getting the attention it deserves with the MAHA movement. They just released a statistic, a 15% weight loss equals $1,000 less Medicare is going to spend per year. So yes, we can make a difference. We're one of the most advanced countries in the world. Why do we have the poorest outcomes? What has happened?
Spend the most.
And
right.
spend the most. Yes. So I don't know if you saw the dietary guidelines getting released last week with the pyramid going upside down, basically going back to how we used to eat with whole foods, nutrient-packed foods, not we are going to take the bran and germ out of a grain and then refine it to where it's junk, all the nutrients and vitamins are taken out, and then it's created with chemicals. It's absurd. So really the big picture is more protein, making sure that people still know that fruits and vegetables are key, and legumes and pulses, and whole milk is now on there for schools instead of low-fat milk, and also no added sugar for children and less enriched grains. And let's talk about ultra-processed food. That's the problem.
And that's something RFK Jr. is talking a lot about.
Yeah.
Is there a generational thing in play? I mean, is it easier for younger people to grasp a different way of going at life, eating healthier, making different kinds of decisions, and that older people like myself, it takes a little bit longer to get us kind of reacclimated to what we should be doing every day. That is exactly what you and the Office of Surgeon General are determined to get across.
Youth right now, half of their calories are consumed by ultra-processed foods. If you eat
their calories.
Half.
Wow.
If you eat ultra-processed foods, you're going to, on average, increase your caloric intake by 500 calories per day. Times 7 days, that's 3,500 calories, which equals 1 pound of weight gain. So really, you do not realize that you shouldn't be hungry anymore. You overeat, and some of the companies have put some addictive substances in there, so you will eat more of the ultra-processed food. But that really is the root cause of obesity. It is the ultra-processed foods that have a high shelf life. I always said to my patients, shop the perimeter of the store where all the fresh whole foods are and avoid the aisles where the
most popular products are that they're pushing with everything they've got. Right.
Yeah.
So let's make a transition into AI for a second. How is AI going to, in your opinion, dramatically impact, maybe change all sorts of things about healthcare, not just in America, but across the globe?
Well, we could talk about research first. I think that AI and machine learning is going to accelerate the innovative pathway for new diagnostics and therapeutics. Cures for diseases could come out of that. And I think that that is super exciting. Yes, we want to think upstream. We want to avert it,
sure,
but diseases happen. Genetic rare diseases happen. That, I think, is really the main focus. I think that you can also have data compilations quicker when you can analyze data you could
Makes
do
sense.
research, right?
Right.
So that's one part. When individual patients are looking at, I have these symptoms, what could that possibly be? I always encourage my patients to have an active role in their healthcare. So if they came to me with, hey, doc, I saw this on the internet, what do you think? I always welcome that. Now this just is in the palm of your hand, and
Yes.
there's so much to be learned from that.
Well, Dr. Oz, who was on this show not long ago, we talked about the most important thing patients can do is have a curious mind.
Mhm.
Not only advocate for themselves, but be curious enough to keep digging for more and more answers. And that's where I think AI is at least an assistant in that, if not kind of a godsend.
Yeah, I mean, and a lot of people have wearables now that are giving them real-time data for their heart rate variability, their oxygen level. There's so many innovative pathways, the continuous blood sugar monitor. You could see what you're eating, how it affects your diet. Now, it could be wrong and you have to double check it, and you should still see your doctor, right, to talk about it. But at least it gives you more information that people in previous generations didn't have.
You know, you don't come to the public service table without influence. One of the greatest influences, of course, is your husband, Mike Haridopolos, former state senator, former state Senate president, and he's now in the United States Congress. When you come home at night, and Mike comes home at night, and you both had very full days, which is probably the description of just about every day. You're up, especially in this orbit. How do you just kind of let it go a little bit so that you can kind of reflect on what you experienced on the day, maybe share what you experienced in the day, and get ready for what's ahead?
What we can share.
What you can share, right, to be accurate, right.
Mike Haridopolos, the love of my life. He is just such a wonderful man. He's a wonderful husband, wonderful father. We have 3 children who are all grown now, and we are truly able to, now that we're empty nesters, dedicate our lives to civil service. And I think we understand how hard each other works. So that actually is helpful. Now, the limited time that we have together, we like to play backgammon. Very competitive.
Who's a better backgammon player?
It's pretty equal, I'd say. We go back and forth. We have runs.
Right.
We like playing cards, of course, enjoying time with friends. Yesterday, we went to church, and we love exercising together. So I think all of that mind, body, and soul and spirit coming together recalibrates us, resets, and then we are energized to go hit it the next day and do the best we can for our country.
Where do you want this country to be 5 years from now in terms of healthcare? What to you looks like achievable success?
I would love the obesity rates and diabetes rates to come down. I think the chronic diseases are at an all-time high, but if we could get our metrics 5 years from now, where instead of 77% of all children are not eligible for the military because of a chronic disease or obesity, wouldn't it be nice if that number was in half? You know, only 1% of the U.S. population serves in the military. My son happens to be one of them. He serves in the Air Force, and I'm so proud of him for that. But that's not the norm now, and that is a problem.
But if we're a healthier country, everything is better. The economy is better, our national security, everything you can imagine that goes into quality of life.
I think that this president has put it front and center. And I believe this secretary is doing, in a short period of time, a tremendous amount, making that thinking upstream a priority. We were able to spearhead, along with Administrator Tom Engels and HRSA, adding 2 rare diseases to the newborn screen. Both of them, MLD specifically, also has a fabulous diagnostic, now an FDA-approved gene therapy, one time as of last year. So if you at birth are checking and you find out that this baby has this disease, they get treated and they are cured.
Right then and there.
With the gene therapy.
Right.
Can you imagine? And they don't have to die. That's saving children's lives.
Well, you are a part of an effort in doing something that often feels thankless. You're trying to fundamentally reimagine healthcare in this country. I applaud what you're doing. I applaud what the secretary is doing. And I'm very confident that not only your heart's and head's in the right place, but you're doing this for a bigger purpose, and it's for the rest of us.
Thank you so much for recognizing that. I am excited every morning to come to work and make a difference. I have this newfound energy every day because I know that what we're doing is almost spiritual to help our future generations of America.
We wish you all the best, because the better the Office of Surgeon General is doing, the better we're all going to feel.
Thank you so much for having me on the show, Adam.
It's been my pleasure.
Thank you.